my name is Connor Howes and this is Practical Assessment 56, Refractometer and Urine Collection. So before we begin, I have washed my hands thoroughly with warm soapy water and I have applied minimal PPE of disposable gloves. I have also collected all of my equipment here today which I'll be using for the urine collection and then the refractometer test. So I have my slip lead and a muzzle on hand for safely collecting the patient. I've got a clean kidney dish which I've wiped out with paper towel, making sure that no foreign debris or contaminants remain in the clean kidney dish here, and it is okay for the free catch. I have a specimen container there and a pen to label. I have some pipettes, but however our clinic doesn't have any, so we'll just be using the one more syringe. I then have a kidney dish with distilled water to clean off the refractometer after the test is finished, and then obviously the refractometer. This is Lola Smith here. She's an 8-year-old female spayed Jack Russell Terrier, and she's in today for boarding and a urinalysis and urine collection. So today we'll be doing a voided catch on her. So before I begin, I will make sure that her slip lead is all ready to go before opening the enclosure. We will loop it through now. And as I am coming to the enclosure, we're coming in from side on. We're not coming over the top. We don't want to be overbearing or causing any stress or discomfort for her. So quietly opening the cage door, we'll give her some pats and gentle reassurance, making sure that she is okay, and getting her head over the loop in the slip lead. With one hand under her abdomen and over her thorax, we will get a good hold, making sure I have control of the hind legs as well before placing her on the ground. Now we will take her outside for the urine collection. So we're outside now and we'll just wander around with her for a little bit, making sure that she gets comfortable. So we want to be coming down to her level, not startling her in any way. We want to be getting the first stream there. We want to make sure there's no sediment or contamination in it, and we don't want to be touching the kidney dish to her body in any way because we want to try keep it as no cross contamination or as less contaminants as possible. Great, we've got a little bit there. Want to note the colour, the turbidity and the odour of the urine. And we'll just walk her back now. Just remove the slip lead. Good job, Lola. The voided catch method was chosen for Lola Smith as it is a stress-free, non-invasive procedure, minimises patient discomfort, and requires no sedation or specialised equipment to perform. So here I have a clean, sterile specimen container. It hasn't been opened, it's got no foreign debris or contaminants inside, it is clean and it is sterile. I have labelled them with the patient details, including Lexi's name, patient ID, today's date, her date of birth, and what method the urine was caught in. I am going to just gently remove the lid here. And at a 45-degree angle, we want to get our kidney dish with our urine sample, and we want to gently tip that in to the container, making sure it is not touching any of the sides or coming into any contact or surface of the container itself, making sure it is sterile. We'll place that one to the side and that'll be set for cleaning and processing, and I'll place the sterile lid on top, making sure it is closed tight. So that one is all ready to go and that one is all transferred. That one will be kept refrigerated until time of testing. So I have my refractometer here and we want to make sure that it is calibrated. It must be calibrated before every day, not between each use, but at the beginning of each day. We want to start by grabbing a Kim wipe and making sure the prism is clean and dry and there are no other dried samples that have left on there from a previous patient. Place that in the rubbish. Then we want to be getting our distilled water here. And we just want to be gently placing a couple of drops on the prism, closing the lid, looking through the eye hole into the light, there, which I can see it is in line with the WT line, and that shadow boundary line has all been calibrated. That is perfect. We'll get another little chem wipe here. If recalibration is required, however, and it is not reading 0, we will need to use a small screwdriver or Allen key that is specific for the refractometer, where we will slowly be looking through the eye hole as we are slowly turning the screw, making sure that the 0 is in line with the water weight line. As we're not using a pipette, I will prepare the syringe now. So I'll remove the lid there. Using the 1 ml syringe, I will gently just draw up a small amount of urine there. You don't need a lot at all. Place 1 to 2 drops only of the urine sample onto the prism. Close the eyepiece. Into the light, you want to be looking into the eyepiece, looking at the shadow boundary line, and you want to be taking note of the USG, which is on the right-hand side. And as I read there, it's 1034. Open up the prism, grab another Kim wipe, as this doesn't cause any abrasions to the prism or any scratches or marks. I also have distilled water here over a kidney dish. Make sure that the sample has been all cleaned. Get a Kimtech wipe there. Make sure it is completely wiped over. That one has all been cleaned there. So we will place the refractometer back in its manufacturer's approved case. We will place a little screw tap onto the distilled water, and we'll place that away in the designated drawer for its next use. So all of this now will just get discarded into the general rubbish bin unless otherwise infected by the patient. That would be considered clinical waste. This kidney dish will get clean, and we'll place that away as we use that for the distilled water, and our sample will get placed back into the refrigerator and only discarded until the vet deems otherwise, and no other tests are required for that urine test. A normal USG for canines is between 1015 to 1045, and for felines it's 1035 to 1060. If we were getting a low USG reading, it may be the result of maybe chronic kidney disease, as this can reduce the kidney's ability to concentrate urine, resulting in a lower USG. Or overhydration due to the increased amount of fluids that has been taken in can also dilute the urine, resulting in a lower USG. In contrast to that, a high USG could be related to conditions such as diabetes mellitus, which leads to an increase or excess levels of glucose in the urine, resulting in a higher USG. Or dehydration, as the body is losing more fluids than it takes in, leading to a more concentrated urine and a higher USG. So now I have correctly finished my demonstration here. I have taken note of the USG, which was 1034, and I will note that on the patient hospital chart. I will note that on the patient file on EasyVet, and I'll also advise the veterinarian. But that is everything today. That is Practical Assessment 56, Refractometer, and Urine Collection.